Okay, so we've got up to an hour, and really the aim of this is to sort of navigate us through all these IT changes and all these bits that we've landed in with the arrival of COVID-19. And this slide is just showing you all these products and things that have landed, and it seems very bitty. What do these things mean? I think in this WebEx, there'll be some of you who understand all of these products that you're seeing the labels of, and some of you that just wonder what on earth are these products, where are they, what do they all mean? So I think that what we're aiming to do in the next God, it's going. Whoops, sorry. Okay, so what I'm aiming to do in the next sort of hour is to put these pieces together, try and make sure we understand what these pieces are. And I'm going to break it down into three components. Firstly, about remote working. How do we work remotely if we're isolating? What is the equipment and the products that the CCG is rolling out? How do we work remotely with the equipment we've got? Second section is, what is a digital front end? How do we work online? What could the front end of our practices look like? What are all the products that we've got that we can use? Are we using it as well as we could? And then finally, a little bit about, which you might have seen from NHS Digital and E, about GP Connect, and we may touch on it. On the WebEx, obviously, we've got Alex, who's the joint IT lead with me. We've got Ian Bernstein, who's not officially an IT lead, but very technical, so I'm sure he can pitch in. We've obviously got Phil, and we've got Jane, who's been involved in quite a lot of these aspects. So everyone could just jump in with the chat, and I'll leave them to answer some of the questions, and they can butt in if I get anything totally wrong. Okay, so remote working. I just want to highlight these products: TeamViewer, Exponential E, Oka, your Logitech Webcams, and Microsoft Teams. So what are they? You might remember we had a conversation more than a couple of weeks ago, almost a month or so ago, about how do we remotely access our computers before any laptops or things materialize. We always positioned the fact that officially things like LogMeIn and TeamViewer were not products that were ever supported or allowed or encouraged in the past, but in these situations, a pragmatic approach about allowing them to be used. TeamViewer is the product we've highlighted the most. It gives you a remote desktop. I mean, the way that I would view it is it's like running your computer in the surgery, but you're at home and your arms are reaching out to control the keyboard and the mouse in the surgery. The advantage of it is it's free to set up if you choose the personal account option. One user controls one computer. It's quick. You can get up and running in a couple of minutes. You can access your shared drive. The negatives are that you have to leave that work computer running. If it's not switched on, you can't remotely from home switch it on. You've got to leave your smart card in that keyboard at work if you want to use a smart card enabled spine functionality for things like System 1. You do get like a slow resolution and a lag. It's not as user-friendly as things like LogMeIn. And Service Desk will not really help you set this up. This is something that they're saying you can use if you need to for your contingency planning, but it's not something supported. How does it work? You install a piece of software, you get like a panel like this. Each computer has this ID number, and you run this on both ends. You can run this piece of software on the computer in the practice. You run this piece of software on your computer at home. When you're at home, in this control remote computer bit, you have to type the number that you see here on the left-hand side, which would be the number on the computer in the practice. That lets you connect in. There is a password that has to be entered. Now, that password is regenerated each time. So either someone at the practice has to give you that password, or you have to choose what we call unattended access, which is you actually put in a user profile, a login, and basically means you don't need to rely on someone in the practice to give you a password each time. It sounds a bit complicated and technical, but actually it's not that difficult. But it still is clunky because you're having to, you have a bit of lag, and the smart card could be in the wrong place. But this is one contingency. It's free and it gives some options to the practice. Let's move on to the next thing, Exponential E. This is basically a virtual private network. This gives you the ability to install on your home devices, on your personal devices, the functionality to connect into the H3 HCSN network. Previously, from a North West London IT perspective, they would never have supported or encouraged us to install the ability to connect to the HSCN from our personal devices. It was always felt that it should be a locked-in, secure laptop from an IG perspective. Again, due to a pragmatic approach that laptops may take ages to arrive, and even if you wanted laptops, there's a supply chain issue because obviously the whole world wants laptops. A decision was made to allow this to happen. The way it works is the practices have given a whole list of users. Jane has been collating it, submitted to the team. The user gets an email that really basically invites them to activate OTA. OTA is authenticates you effectively, and it sounds a bit technical. I'll show you a couple of shots to show you it's actually quite simple. If you think from a cost perspective, each license covers one user for 1 year, and it costs about £102. So, there is a cost that the CCGs are paying for these licenses. And the plan had been originally that they purchased 500 licenses for all the practices across North West London. Ealing on its own has taken 300 licenses. So you can see that we've taken a huge amount of those licenses and they've had to increase their purchases. But you can see it's disproportional to all of the 8 CCGs. So, and that's a credit to all the works of Jane and the IT teams and Nim from the Federation to collate all those requests and to really push them so that we could get those users live. The advantage of this is you don't need to it's nothing to do with your work computer. You're connecting your personal computer to the network. You install System 1 on your own personal computer, but you do need a smart card reader on your personal computer to use your smart card. If you don't have the smart card reader, then again, you're limited with the System 1 functionality. You can't access things like EPS. This solution does not give you easy access to your shared drive at work. And this is not a solution for Macintoshes because, unfortunately, it needs further software and at further cost. So Phil has created this really great guide that walks you through each step of it. And when you go through it step by step, you should get it to work. How does it look? Once you've got it installed on your computer, you have this little interface here. You just type in your username and password. You install the OTA app onto your phone. And what you do is you just click an option. I mean, there's two options, but there's an option called push, which you just press push. And then basically, this is my phone here. Obviously, you may not have a phone with children on sledges, but bear with that. So basically, you have a push notification, say, OTA verify. Did you just try to sign in? When you open your phone, it just says to you, did you try to sign in? And you just say yes. And you've instantly then connected. So it's actually a really quick process once you've got it set up. What are the problems? Well, the first problem is that everyone got those emails. Practices probably listed all their staff. The staff got that email. They thought, what on earth is OTA? And they probably ignored it. That email only gave you 7 days to click a link to activate it. So the first thing is that all practices need to really check with their staff on those lists. Did they know what this was all about? Did they miss those emails? If they did and they missed that window, they need to contact service desk to request a new activation. Make sure your staff have Phil's guide, otherwise they'll still be stuck and they'll go nowhere. What are the issues? The issues that I'm aware about, and again, the chat may, in the chat there may be some answers to some questions, but the main issue is what we said about the Macintosh is it needs extra software, which is quite expensive. There is an issue potentially about can you access ICE through it, and I don't know if it's been resolved now. Third issue is there's one setting that might need to be changed on your personal device to get it to connect, but the company's working on it and it may be now resolved. What is the big thing that I need practices to do? We need practices to really either use this or lose it. You can see we've got 300 of these licenses, and I imagine a lot of practices didn't even really realize what this email was about. So if your staff are not activating, not using these licenses, we need to transfer them to other practices that can use them. So that's the action that really we would be encouraging to happen. Okay, so, sorry, okay, oops, going back up it. So let's go to the next set of equipment, the webcams and headsets. Effectively, we just got a supply of webcams. We had a number. We quickly did some calculations about how can we distribute it. And it came up with, one webcam if you had less than 5,000 patients, 2 webcams, you have more than 5,000. We had a headset, so again, it was divvied up like that. Smart card readers, again, national supply issues, lots of different brands, because it's the bottleneck. If you get the Exponent license and you don't have a smart card reader, you can't get the full functionality. We would encourage you, and again, they're being distributed, we would encourage you to even buy your own if you're stuck. They're not expensive. Some thoughts here, could we justify webcam in every desktop on every clinical room in practice? I think we could. The question is about funding and supplies. Another thought that I would say is it worth having a privacy, buying a piece of plastic to cover these webcams? If they're in clinical rooms, in terms of privacy or perceived privacy, is it worth having a plastic cover? Again, you can buy sort of things off eBay and stuff. That's something you may want to think about. With the actual laptops, most of them have probably got a webcam built in, even personal devices. So probably these webcams are best used in the practice, although they are designed to really support the remote working. So now we come on to laptops, the COVID laptops. So again, we've got global supplies issues on these laptops, and there's 3 waves of these laptops. And again, real credit to Jane and the team to manage all of this. We've got 76 laptops that have arrived. They came from National NHS England supply. They do not have integrated smart card readers in it. If we had to try and wait for them, they would probably never have arrived. There's a distribution that we need to think about, but you can see the numbers are small. Even if we go by list size, this is not many laptops that arrived. Wave 2, we were expecting another 131 again from NHS England, but this is now overdue. We're not sure if that's even going to materialise. Wave 3, North West London CCGs have purchased their own laptops. We did this at the beginning, thinking that the other things may not materialise. But again, we're only talking about 100 laptops. And this may cover more than just primary care. We may need them for CCG staff and other things. So again, we're not looking at huge numbers. The take-home message when you look at all of this is, first of all, how do we divide it up fairly? It's difficult. Practices have got existing laptops. They've got Exponent licenses. We've got to look at list size. But the way that we're thinking is that every one of those counts. If you have an existing laptop that we think you have, unless you've logged it that it's faulty, we think it's working, and you've got to show us the service desk log. An Exponent license, again, if you've got a request from your staff, unless you've logged it or given it up, we're counting it. And then we're going to have to think about these new laptops. But if you look at these numbers, think about we've got 300 Exponent licenses. Really, the take-home messages isn't the best option right now, exponential E. If you wait for all these laptops, you're just not going to get them the numbers you may be happy with, or they may not arrive when you want to do. We've got another problem. Your existing practice laptops are on Windows 7. They're going to be end of life in a few months' time. So if you're planning for the rest of this pandemic, that you're going to start to get laptops that you've already relied on just not being able to be upgraded to Windows 10, and then we're going to have a bottleneck. So again, Exponent using your own personal devices may be the solution to some of this. Then finally, talking about this sort of remote working, Microsoft Teams, you've probably heard the announcement that NHS purchased it as part of the COVID-19 plans for the whole use of NHS. It's, it gives video conferencing, so it's like this WebEx, but it's got different functionality. It's got additional things like file sharing. You can get access to it and support, help to guide you through it through NHS Mail. The CCG is already using it now and replacing it, and Mahini's really keen. She's using it probably more than all of us, and we're moving most of our other meetings into Teams. I guess there's a conversation for even as council members: do we move to Teams? We do test. I've written a comment about Zoom versus Teams. I think a lot of practices are probably using Zoom as well, and it has lots of, it's good. It's got lots of things. I think there's going to be a longer term discussion about do you move to Teams, particularly if you're going to start to have conversations across the NHS and you're trying to invite other people. Will Teams in the longer term be better than Zoom based on the fact that it's got that national rollout? So potential actions that practices may want to consider. Do you want to set up your own Teams? Do you look at this functionality? Do you start downloading it on your devices, on your desktops, on your personal devices? Do we need to think about a test call to think about this? There are some issues about admin rights and sorting this out, but is this something that practices want to look at? That's the end of the first section. I don't know if we want to pause for any questions. If anyone wants to ask anything, or we feel that things are addressed on the chat, I'm going to steer to my colleagues, Alex and Bill. Should we head on?
I suggest we pause here for a moment.
Yeah.
The couple of questions. One of them was around exponential E. Can we circulate the guide to it? And I think a lot of people have, there's a lot on the chat around how you use it on Macs, and I'm assuming it either through Bootcamp or through Parallels. I think that would be helpful to circulate that. And then, of course, once you do Parallels, you then have to run the Windows. You have to buy the Windows for that as well. So I think that would need to happen. Were there any other questions on that? Microsoft Teams, who can upgrade our Teams? Victoria, I'm not sure we can upgrade our Teams functionality anything more than we have. I don't know what the issue is, but if there's an issue, let us know. Ravi has have the 300 exponential E licenses been distributed? If so, how do we purchase?
If we could come in here, I mean, at this point in time, first of all, I think Arjun's on the call. We firstly have to say thank you to Arjun because he's helped push North West London to consider exponential E. We haven't closed down at this point, and if you practice didn't realise about exponential, didn't really understand it, and we have had emails with lots of practices even on this call in the last few days, not really understanding what was exponential E. Please revisit it. Please encourage your staff to look at it, because if you look at this trajectory with these laptops, I think it really makes sense. And this is a personal opinion, not necessarily a CCG opinion, but I do know Alex, myself, I think even Ian, a lot of us do actually prefer using our personal devices. I know there's information governance issues, but if you're using System 1 remotely on a window, you're not saving stuff on your computer, the risk is low. And I would view that even NHS Mail on your personal computer on Outlook is a high risk as well. So I think we can relook at it, and from a cost modelling in the short term, it's probably most cost effective. £102, if we're having to buy lots and lots of laptops at expensive prices, and then the IT team that needs to set them up, if we can get exponential E to work in the short term, I think we should do it. But we need practice to prove they're using it. If we see that no one's activated it, logged in, we just cannot justify your staff still having this license, and we need to transfer them.
The question was, will North West London team, do they support exponentially?
Yeah, I mean, Teams is separate. Teams doesn't even need exponential. You're not on the N3 network, the HSN network. Microsoft Teams is a separate product that does not need HSEN.
Shanker, one question around the guidance that Phil's produced. In there, does it list the basic minimum requirement of your personal device in terms of what you need on your personal device before using exponential E and using System 1?
I'll let Phil answer, but I don't think you need a huge amount, because I mean, I'm right now on an 8-year-old laptop, and I still think it's better than the CCG laptops in some ways. You don't need a huge amount. I mean, ideally, I think people are probably on Windows 10 now. But Phil, do you want to come in with any comments? I mean, System 1 was designed to run on a very light.
Yeah, you don't need any. You just need to make sure your antivirus is up to date. You need to make sure that your Windows update has been done, so you've got all the latest patches on your computer.
I mean, I'll tell you one other thing. I actually think it's easy. I mean, I'm actually in the hub at the moment, and the reason I'm using my personal thing is even the things we're about to show you, AccuRx, video consultation, it works even slicker. Sometimes and it isn't, again, it's not the official NHS London or NHS North West London position normally, but at this point you may find that things actually work smoother for you. But the biggest thing though is, and I guess Phil will probably back us up, is the service desk cannot give you personal support on your personal devices. They may help you a bit of getting exponentially working, but if it seems like it's a big hardware issue with your device, and they cannot get you live, then there's a limit to what support they can do. Versus if it was a CCG supply laptop where they built it, they understand the locks on it, they can support you far more.
Okay. Right, let's move on. Yes, if you are going to use on a Mac, then yes, you have to buy Parallels and Windows. Did it for 10 years. I mean, yeah. Okay.
Okay, so let's move on to the digital front end. So I'm going to try to, when I go through this section, some of this may just be too fast, that you don't understand what we're doing. I'm not going to show through every step, but if you start to get some of the sense of what this can do, Maybe you're doing all of this already, but I'm sure we can then look at training or further WebExes, and Phil and stuff will potentially maybe be able to facilitate. But anyway, let's crack on. So maybe it's time to say some goodbyes. NHS Choices, let's just make sure we're clear. It was rebranded. It's the NHS website. Sometimes on our comms and our messages, we still refer to it. You may remember the Health Help Now app. We've been promoting it on North West London and beyond. I'm going to suggest now it's time to say goodbye to it as well. That decision was starting to be made before COVID. And there's a few logics about when you see the apps, we're thinking it has some really good local signposting, but our data from our Ealing users and our user patients showed they were just using it for seconds and limited. So the amount to support that app, it was a very low cost app. It didn't cost us much, but the staff time to keep it updated is probably not worth it. And System 1 Online, there's a new System 1 product in town, and let's have a look at that together. So let's race through some things. Your practice website, a really quick, small functionality to highlight. When you're doing shielding letters and lots of letters that you have to do, just remember that you can upload something to the media library. So if you look here, media library, you can upload a document. Then you can create a URL link. You could text patients a link to a letter. So if you'd have to make the letter generic rather than their name, like dear patient. But if you wanted backup copies of shielding letters or other things that you did, the LMC note letter, why not think about putting it on your website so you're just not having to chase email. There may be some patients who want it in their name for whatever reason. That's a separate issue, but that's a quick functionality on your website that you need to make sure you know. Next thing, media screens. You may think that this has probably got no place at the moment because patients aren't coming into the practice. Just wanted to mention that there has been a refresh. Practices, we've just updated all the content, added a few more practice elements to it. It's a significant refresh, and you may have had your own playlist in your own practice. Just be aware that we've probably gone into being more practice orientated too. If you think there's stuff that you've got on your media screens that would be useful, let us know. And I'm suggesting this going forward into the future when we maybe start to open up, how do we message? At the moment, I've put on a lot of COVID type material. But you can be simple. I had a patient who said, do you want a photograph? And offered me a wildlife picture. And I said, do you want us to stick it on the media screens? And you can make a quick slide like this. We started to look at user content. We got a donation from a pharmacist to look at medicines management. There's a lot of future in this. And again, I know it's not so relevant now, but think about looking at your own content and think about from a PCN perspective in the future. You can publish, to practices centrally. We're not really using that functionality. And the practices that have decided not to put a media screen in, sometimes that may have been due to technical issues, but you may have just thought, well, what's the value of it? And I would say, well, maybe this will take off some of your workload from messaging to patients. So if you haven't had it till now, think about whether it's something you want to do. Okay, so then the next thing we're going to talk about is the NHS App. So the NHS App is obviously the new front door for the NHS, and it has the NHS login. If you've looked at it, I don't know if anyone's attempted to create their own NHS login. I'd really encourage that everyone does it, so you can experience what it's like. You have to sort of upload your photo ID, it verifies you, and you get approved. It's far more secure than a lot of things that we do to authenticate people in my position view. But the biggest thing is this removes a huge amount of workload from practices. Previously, you had to generate System 1 logins, get them to show ID at reception. If we push the NHS App and push the NHS login, then actually we're taking that workload and they can do it now. They don't need to come to practice to do any of that. The functionality of the NHS App has the usual things you would have thought about: appointment booking, record access. You can do things like change your nominated pharmacist from the app. And the next thing I want to mention is it's now integrated with eConsult. We'll have a look at that again. But just to think through how that could help you with promoting online access. eConsult, we've got 64 practices live at the moment and 3 about to go live. One practice is using Ask My GP. We've got 7 practices that are undecided. So first of all, thanks to Adid and Jane and the whole team for getting all these practices to mobilize so quickly. And it's really impressive. I probably don't need to tell you the weaknesses and strengths of it because you're using it. But don't have to configure it. The weakness is it is off the shelf and non-configurable. Really to reach out to the 7 practices undecided. If there's any chat conversations you want to share with them about your experiences, the good and the bad, please do. Personally, I think from a governance perspective, an individual practice would struggle to create protocols that are stronger than an off-the-shelf product that's used by so many practices across the country. You're receiving the messages in by email for most of you. There is an interoperable version. We haven't launched it with you at this point because the provider wouldn't have been able to mobilize you quickly. That's something for the future. So really, the next step is how do you maximize it? Have you looked at all your messaging, your practice websites, your phone messages, your emails, your posters on your front door? If you've got a locked door, have you stuck e-consult posters to signpost them to it? Is this a way you can do extended hours? Can you remotely log in and clear e-consults? Is that the most efficient way to achieve the extended hours DES if it's still in operation? Then if we look at how that functionality works with the NHS app, you can see that it is seamless. When they go into the NHS app and they ask for advice, it just goes through to now to e-consult. If it'll know your practice is live with it, and it's seamless. It doesn't even really brand it as e-consult. So that's another reason now to promote the NHS app, to promote also access to e-consult that way. From a practice perspective, it comes through exactly the same way. So now we move on to the next app. So we've talked about NHS app. We're now talking about Airmed. Airmed is System 1's new app. It uses the...
Shanker, before you want to this one, do you want people to ask any questions, or do you want to go through? No,
we could pause. E-consult. Does anyone want to ask questions up to this point?
Yeah, just about e-consult. Were there any questions? So I didn't know. I'm going to kick off. Didn't know that we were holding on interoperability with tasks rather than things coming to email. When will we be rolling out that functionality?
Basically, the company, really, we mobilised very late. We did a rapid mobilisation. They said that we do not have the capacity when we're mobilising. Obviously, the whole country's rushing towards e-consult. There are a couple of pilot practices that have got the interoperability. We can see it works. The gap for the company is they have to do the training materials and they need more staff time. They're focusing their staff on mobilising all the practices and also focusing on server and resilience. We have had conversation with the company that we want to be first in the country. When I say first, I mean North West London, to roll out, but they cannot give us a timeline at this point.
That's fine. So as long as it's in the pipeline, that's fine. Okay, yeah. You're saying that we should all be encouraging our patients to use NHS app, and they don't even need to use System 1 to log in and use the NHS app for everything.
Well, I'm actually saying two things. We want our patients to download 2 apps, the NHS app and the Airmed app. You could argue the Airmed app on System 1 has a lot more functionality than NHS app. But there's bits in the NHS app that are not in the Airmed app, and the one bit is the things like the e-consult. It's in the NHS app, it's not in the Airmed app. The thing about like changing your pharmacy is in the NHS app, not in the Airmed. So I know that's still not a bit messy, but I think the message would be our patients to download both.
Okay, let's go.
Airmed does not need to log in once you've got your NHS login. You use the same login to get into Airmed.
Okay, over to you. Okay, keep going. I don't think there are any questions.
Okay. I'm conscious we're going to probably run out of time, but I'm going to go quickly into Airmed, and I'm just going to show you a little bit of a whiz around it, but not explain it fully. It can do video consultation. It can integrate with things like Google, Apple. It can do things like let patients enter data. But I'm just going to try to see. Can you see? Can I just check? Can you see my screen in terms of video? No. I'm going to share a different screen. Isn't it? Hold on. Okay. Okay. Can you see this video now?
It's blank at the moment, Shanker. Yeah, okay, now we can.
Okay, right. So I'm just going to whiz through this video. Can you hear sound or?
No, not sound.
Okay, I'll just talk through some bits, but you can see the video.
On time.
Okay.
Yeah, we can see sound now. We can get sound.
Okay.
Patients, when a pathology or radiology result has been filed, in the same as your system online. And also full record, I can see that the patient app. So being able to grant
So I'm just going to get
the
to
NHS login.
Okay, this is just walking through some of the functionality of the app. But I think what I wanted you to visualize is
The first option, like this COVID-19.
First of all, it's got like a COVID symptom checker in it. You have things like conversations and messaging. One second.
So I've already got a rotor here, and it's got some of the video consultation slots within that rotor.
But I just want to show you how you start video consultations by right-clicking on your appointment screen, and then you can see it starts to open a video consultation.
Record and display the code, which can then be copied and pasted into a browser that's also been opened.
So it's very AccuRx in some ways. The difference with AccuRx is you didn't need an app at all, which is obviously a massive point. What we understand is that TPP is working on it frantically to try and catch up with AccuRx and not need the app. So that's firstly a bit about video consultation. So similar to AccuRx in some ways. Other functionality is looking at prescriptions. And data entry, so you can. So, for example, do you start to do blood pressure reviews where you get them to put their home blood pressure reading into the app? That data you can accept into your system. Does this help you with remote management? Are these tools that you want to consider doing? I'm going to actually try and pause it. I'm actually probably going to abandon it at this stage, but this is a video that you can have a look at, seeing some of the functionality. Right. Okay, so I'm just going to.
Here, such as interactions with people. So perhaps when their eyes start to move to watch you. Going back to the menu, now let's look at the dental health functionality. So this is basically just allowing you to record the date that
Okay, 1 second. Okay, so it also has obviously the full data record. So if you did go with Airmed, you just need to go to organizational preferences, tick a box, and you've enabled Airmed. You've also got options about, do you allow them to enter, do you allow patients to enter data that you can view? Do you allow notifications? So that's an organizational preferences. With video consultation, there's another organizational preference tick box that you enable. But at this point in time, I'm not suggesting that video consultation is where you're going to go. We're going to have to watch to see how this develops. AccuRx is probably the product you're going to go for. So that's Airmed. Now we're going to talk about EPS4.
Airmed live now. Can we start with Airmed now or not yet?
You can start with Airmed now, and I would encourage people to do that because you've got the NHS login, the System 1 app. You're going to have to get patients to generate passwords and stuff. I would go with Airmed already.
Okay.
Shanker, just to say that if people have got a System 1 login already,
yeah, it would work.
The System 1 login works with Airmed. It just transfers over.
Yeah.
Okay.
Okay, EPS4. I think all but 10 practices have signed up with it, and if you don't know what it is, it just allows you to send prescriptions electronically without a nominated pharmacy. You may have, you just again have to go to organizational preferences to tick it. Because most of you are live with it, can I just suggest in the chat, please feedback your positive or negative experiences so that the 10 that haven't switched it on can think about switching on, because I really do think it's extremely helpful in this scenario. You might have spotted the recent System 1 updates this week. You can now do one-off nominations, which means you can send it just to one pharmacy. I'm actually not going to show you this video just because I think we'll start running out of time. But what you can see when you look at this link is not only can you just see one-off pharmacies, you can also see opening hours. So it's actually all built in to help you. I mean, particularly really useful for us in the hub. But imagine, we've got patients isolated across the country, and when you're stuck with those dilemmas about do you help them out remotely, this is probably something that can really help. Now, where we join the dots together, Airmed will help you with EPS4 because Airmed will show you the prescription barcode numbers in the app. For your patient to get that prescription easily without a nominated pharmacy, they really need either the barcode from this prescription or the NHS number. Pharmacists would probably ideally want the barcode, The NHS number, the pharmacist just has to log in and get the prescription details. They could try to work it out without even the NHS number, but the pharmacist probably wouldn't be your best friend. So this again joins the dots together, makes it easier for you, not doing tokens if they've got the Airmed app. Now we're going to go to AccurRx. Now I'm going to assume that everyone's tried it or played with it a little bit. You've got, we're using it mainly for video, and you've got the standalone option that you're just using your phone, using this link. I want to just promote the desktop version as well. And, I'll give an example. Crown Street probably was racing to us saying, please, we need help to install it on everyone. What we understand is that there could be variations. Some practices may be able to install it straight away with no blocks. If you find that you're getting a block, you've just got to appreciate that IT help desk may have some limited capacity about how quickly they can get you to install it. And I think I may be right. I'll let Phil and everyone answer in the chat, but I think the Windows 10 hardware may be different to the Windows 7 in terms of whether you find it easy or not to install. But the advantage of it is if you run the app with your webcam, you're sticking information into the patient's record more easily. And you can do other functionality, which I'm just going to show you briefly now in case you're not doing it. To get into this functionality, as a practice, you're going to have to set up an admin person that runs the AccurRx account and you approve all your users. Otherwise, they will not see this functionality. The first functionality is to send documents. This is great for your medical certificates, the med-frees. So you literally send a text, but you can attach a file, so you can save the medical certificate, and then, so as you see from the screen, the patient gets a link. It's live on there for 14 days. When the patient clicks a link, they enter their date of birth, and then they can access the document. So really helpful, avoids you having to chase their email addresses and to send it. The second big thing is receiving photographs. If you're doing an e-consult or something, and then, the typical scenario is they haven't sent a photograph, you often go in a loop, ask them, can you email a photo to the practice? You could just do a text. They can text, you can tick an option here to allow them to text back with a photo. That means an image can quickly come across. And again, the beauty is if you're running the desktop version, it can help push it into saving to your records. So again, save you time doing those, the rashes and the typical things we're doing remotely now. So I just want to flag those two functionalities that you may not be all doing, but now you know it exists. This is the dilemma though. It's free at the moment because of COVID. So the company have made it free, but obviously there's going to be charges in the future. They've stated that a basic version will remain free in the future, but we just don't know what that will mean. So I want you to realize this open dilemma here. At this point in time, there's no guarantees about funding or the future of this product. So if you really, really like it and you get ready to just be aware of that, we will have those dilemmas in the future. If suppose North West London or the CCGs did fund it, we still, the financial value of this, it could end up as a procurement with lots of providers. There's no guarantees it ends up being AccurRx. So that's another reason why looking at Airmed, it's a free product, it's integrated system one. It may not have quite everything with AccurRx, but I think we're going to have to watch both of them closely in the coming months. Okay, and then finally, this is really quickly about, just to make sure you know about some of the functionality about medical certificates. This has just been the latest update, I think, on System 1 this week. When you do medical certificates, now they've introduced the printer setting option into the medical certificate. So rather than ticking OK and prevent, if you do printer settings and you change your printer to print to PDF, it then becomes a PDF document. You just flip it, you open up in Adobe, you flip it around clockwise once, and then you can add a signature. And I'm not going to spend a lot of time on this, but here you do add signature. On Adobe, you can even draw your signature with a mouse on a pad. It actually sounds complex, but when you do it, it's really simple, and you can save it so that you only have to draw it once, and then you can put it into, you can click it into this space here, and then you save it. So you've signed it. When I've looked at the guidance of medical certificates, they're still saying a wet signature is needed, and a wet signature is, by their definition, even a scanned version of is acceptable. There is a risk if you send them all unsigned emailed that down the line some of them may be rejected. The only other way around it is to send a duplicate. A duplicate does not have to be signed. So if you do a Med3 duplicate, you could just email it across, but this is your ability to sign something in PDF. It saves your admin staff scanning things and emailing it as well. And then talking about those two things before, we've talked about all these prescriptions, all these Med3 certificates. Think about your reception. If there's all these prescriptions that are paper, is this your chance just to go through them and reissue them as EPS4? And what about all those uncollected Med3s? Is this a a clear out time. And then I'm just going to mention this other thing that's always been there in System 1, adding a patient's photograph. I personally have always wanted to do this for 10 years, but now in the world of video and stuff, does it help you with identification? Does it help you when they're walking in the practice building? It's really simple to do. You just go to record attachments, set demographic picture, you click on detect camera. If you've got your webcam in, you then click on this image capture. So if the patient's with you, you do it that way. It just pops up, you can crop it. It's actually quite simple. If you've got a file, you might want to take it from their registration document, or I've even done video consultations where I now ask for permission to take a screenshot, and I've added their photo that way. So just think about how you may want to do that, but obviously think about consent through that process. Then the next bit, do we need to rethink also online registration? System 1 has that functionality. It can gather the information from the patient, bring it in as a task. At this point, NHSE and stuff is still asking a form of patient signature to meet their requirements to onboard the patient. The patient even emailing you a letter would suffice if it had a signature in it. Could this reduce your admin stuff? I would throw out a challenge. Do we gain as much as we used to collecting all this information in a very detailed form? If most of our patients get a GP to GP transfer of the records, do you just need manual forms more for when they've just never had a previous GP or there's a problem with the transfer? Just something to think through in this time when you don't want patients to come in to register, but we just need to still give them a service. This is section 2 done. If we pause here for any sort of questions at this stage?
I think Alex has answered most of the questions online here, so I think we're okay to keep moving. Yes, okay, we will share the slides. We'll definitely share the slides after this, definitely. Yeah.
Okay, so section 3, this is the final section, is looking at GP Connect, NHS 111 and shared appointments. I'm going to keep this very top level. So this is the letter you may have seen from the 24th of April. It asked, it basically explained that we had a previous letter that asked practices to switch on GP Connect. This letter was now saying that naturally they're just going to switch it on. It also talks about things like summary care record and forcing more sharing. What is GP Connect? GP Connect is the infrastructure to show, to share patient to GP's records, but also to enable appointment booking. You might be confused because we're kind of already doing remote booking. You know, how's that happening? We've got other functionality, lots of local function in North West London that's set up from different clinical systems which allow that. GP Connect is more of a national standard. In some ways, maybe better than what we're doing locally. The dilemma here we've got is even if a patient calls 111, there's no guarantee that that call comes to our local providers, UK and LCW. If it does come to them, they probably can remotely book in. If the call went elsewhere, then they would probably only be able to do it if they had GP Connect. Now, I think we still probably need to give you some more detail after this call because it's literally hot in terms of discussion with Phil and the IT team about what steer do we give people. But I just want to show you where you find it in your practice. The SCR changes, I think, are probably less of a change that you're going to get involved in at a practice level. NHS Digital said that they will revert all these changes in the future. So it will go back to your previous settings. And that is covered in that letter that they circulated. But I want to show you where is GP Connect. So if you go to organisational preferences and you look down here, you've got GP Connect. And basically, if you enable it, you can decide what slot types and things you select. Now, a personal view that I have is if they enable us nationally, is there a chance that they enable us and we don't have complete control over which slots that people book into? Could there be an advantage? Do we look at it locally in North West London that we do steer people to adjust their settings or look at it? I'm not saying that's the right answer. I think we need to probably give you a little bit more of a steer. So I imagine we need to come back to you a bit more with that as where do we go. But that's where the control lies in organisational preferences. This is the second bit, external appointment booking. Now, what I would say is that you should have this ticked. And this shows you your slot types that are bookable by 111. I just want to put on another hat as a 111 clinical lead. I know you've got the letter showing you how many slots you need to do per 500 patients, et cetera, et cetera. I just want to give you that assurance. even if you do not enable appointments, even if you don't put the slots, the patients are, there's no change in the patients that get referred to you. You've always had, if they think that they should contact the GP practice, you always got a 111 report directed to you with patient told to contact the practice. The only difference of putting the slots in is rather than just being told contact, they may book you into a slot. I don't know if you've already experienced it, but I just don't think you'll find most of these slots used. I know that there's a fear putting on all these slots. I just find you'll find that most of them are just still not used. So I just would encourage you not to be too fearful of it. And even if they did book something in, I just think you have to monitor it with your duty GP and probably just call that patient straight away to clarify. You might even want to use video if you can, and you might be able to manage it and close it. So that's the appointment booking that should be enabled. And then the final thing I just want to mention is about things like shared appointments. And I'm not going to go too much into it, but I know that some of the PCNs are exploring it. I think Mark's PCN is looking at this, where you could share appointments, but there's a limitation that you can only share with 20 practices. So if you had contingencies or you wanted to offer services across your network, this could be a solution. There's lots of other possible solutions, and I think Phil and the team would guide you through your options that might suit you. But this enables you to book into each other effectively. So I'm going to leave you at this point. I know that was a race through, so we've got some time for questions and to thrash out some issues. But what I do want to say on this last slide is that there's a huge thanks that needs to go out to, I've named three, so it's obviously the CCG team with this equipment and laptops and all your licensing requests and trying to manage that. The North West London IT team, which is a huge ask across the whole of North West London to roll out all of these products and chase this. And you may wonder, why am I saying Gordon House Surgery? Well, I'm here in the hot hub. If you were Gordon House Surgery, you would know why. They've had a big IT ask of them to allow the hot hub live on their practice system one. Have to have random staff, as smart card people like ourselves, have had to look at appointments, patients calling their system, text messages saying the wrong name, things like this. So we just got to appreciate that because we wouldn't have gone live with the hub unless they allowed us to do that. So that's a massive thanks. And hopefully, we hope that we can start to maybe consider leaving your system and go onto a separate hub. But thank you so much. So I'll pause there.
Yeah, well done, Shanker. I think just looking at the chat, everybody's hugely appreciative of this. I think it is fair to say that this is perhaps the most transformational bit for general practice. It would have taken us 10 years to do what we managed to achieve in 6 weeks. So a big thank you to you all. I think what you have outlined here very nicely, Shanker, is we've got the fundamentals right. We now need to maximize the use of all the functionality within the online and remote tools that even I was unaware about. So I think that is incredibly helpful. Maybe I think in every council of members, we do a bit of a slot on it, on a tip for the day or something like that. So we keep the message going on this, because this is, I think, the biggest game changer for us in primary care. And we've recorded this training and we put a link on YouTube, and we'll send the slides out.